I am Erica Holt. I've been working for the past several years in health communications, digital health for federal clients and nonprofits. Before that, I was at UCSF Medical Center. This is from a communication perspective. I know there are a lot of different groups here. First of all, I just want to start to say that this is really about a conversation, kind of the start of a conversation based on some of what I've learned in school. I'm also a grad student at Johns Hopkins in communications, and a lot of what I've experienced related to certain myths and misconceptions that are very prevalent, especially in measuring healthcare and public health social media efforts, and just starting to talk about maybe how we can question some of those assumptions. As far as what's working and what's not, starting with measurable objectives and working back, I think, we all know that that's the way to go, but ultimately what seems to happen is there's a focus on engagement as kind of the ideal goal. We are at a point where there are no standards for social media measurement in the industry. Healthcare communication and measuring that in general presents some additional complications, kind of compound that with the lack of a true industry standard, and it's really too soon to be talking about best practices. I think the key one that we see is the idea of engagement as the ideal goal. And engagement, not like we had talked about earlier, but this idea of sort of the level of interaction, the amount of comments, the amount of retweeting that happens. That is not necessarily an outcome. Now, it can very well be sort of on the way to an outcome, or it may very well be your outcome, but I think because of certain assumptions that we're working from that aren't necessarily based in empirical evidence, we've come to rely on this, and it may be time to question sort of how we look ultimately at objectives, working back from those, and seeing sort of which engagement metrics really matter and which ones don't. Kind of another term that's thrown around quite frequently is ROI. I think most know what the term means, I see it used quite frequently to mean results, and we're really talking about a financial calculation, and it seems like there's, especially working on the communication side, there are a lot of miscommunication that happens with different groups, especially people who are looking at it from a business perspective. It's something that's very, very difficult to calculate from social media. It's difficult to calculate, period. But the idea that it means, whatever your results are, which is, definitely something, that we're looking to measure, but ROI and social media don't quite go together just yet. Just some more myths that more data is better, that something that's more measurable is necessarily more effective. So again, this is really based on a lot of what I've observed and read in the empirical literature, but I do think we're at a point to not sort of look at any frameworks that might be out there, but instead really look at what you're trying to accomplish. We often hear about health outcomes and behavior change when it comes to social media. As far as what the literature shows, there's not a lot of evidence supporting those outcomes, rather some kind of more intermediate goals such as learning, customer service. What we just heard about from University of Maryland is a perfect example of an excellent use of social media without sort of a monetary or behavior change goal. Again, this is really just the start of a conversation. I do think it's time as a field for us to start questioning certain assumptions. I'd like to have that conversation. I don't have all the answers by any means, but I do know there's a certain lack of evidence, and sort of looking to those original thought leaders and sort of this over-focus on engagement may be leading us to a bit of disappointment in some of the early outcomes or lack thereof we've seen with social media and healthcare and public health.